Okay, so we're moving through the alphabet for the micro lectures for conditions for the MLA. Come on to migraine. So a fifth of all the population of humans on Earth have migraines regularly. Probably about a quarter to a third have had a migraine before, so it's super common. And you can get lots of different types of migraine, but to cut a long story short, the common ones are migraine with aura or migraine without aura. That's sometimes called migraine vulgaris or common migraine. Pounding headache, people feel sick, they sometimes vomit, they might want to be in a dark room, they want to lie still, as opposed to the autonomic cephalgias like cluster headache where they're very agitated and move around. And people usually want to sleep it off. You can get several per week. If you have an aura, there are different forms, but often visual, so sparkly lights. I think of it like the Star Trek warp signature. If you're a nerd, you'll get me. People can get scotomas or areas of blindness that kind of move across the vision, or fortification spectra, which are like sort of crenellations of a castle or zigzags. Younger people tend to be diagnosed with migraine, women more than men. Often there's a family history, but older people can develop migraine, particularly after a head injury or a stroke or something like that. There is a physician, a Scottish physician called Dr. Airy, who drew his tachopsia or his visual aura in his migraine for a journal in the Philosophical Society. And I think it's really nice to see. So this is what people see when they look at a page. They see this kind of growing blankness that moves across the vision and then resolves. And I've shown you a little Star Trek warp signature there for scintillations because it's cool. Star Trek's cool. I will hear nothing of it, no comments. So treatment for migraine. So it's a primary headache, so there's nothing underlying it. A secondary headache would be something like a brain tumour, for example. It's a condition that causes a headache as a secondary symptom. Migraine, it is headache, that is what it is. Treatments are two flavours: preventative, to try and stop you getting it as regularly or at all, or acute, when you've got it. When people have migraine, they often have vomiting, the gut stops working, so tablets may not be helpful. Sometimes there are nasal sprays or injections that we can use of triptan, which is one of the abortive or switching off medications we use for migraine. Migraine auras should fully resolve. So if somebody comes into A&E and you're asked to see them, oh, they're blind in one eye, but it's probably a migraine. Well, do they still have headache? No. When was their migraine? 3 weeks ago. That's not migraine. Okay, so you need to investigate why this person is blind in one eye. There are other primary headache syndromes like cluster headache, but they have different features to migraine. So people can have two types of headaches, unfortunately. A new migraine with visual loss in the elderly, beware. Think about things like giant cell arteritis, ask about chewing pain, ask about sort of visual distortion, temporal ache, and also there are things like glaucoma. So if the pain is particularly bad when they move from light to dark or dark to light because of the increased pressure in the eye. So I always say new headache, which is lateralized with visual symptoms in the elderly, always check ESR, over 50, always check ESR, and always check the intraocular pressure. So, summary of migraine: you can have common migraine, vulgaris, you can have with aura, you can also have acephalic. It doesn't mean the patient has no head, but it means that they just get the aura but no headache. They can be more tricky to diagnose with certainty, but if you're having classical migraine aura, which then fully resolves, and a normal scan, that is diagnostic of an acephalic migraine. People can be very poorly with migraine if they get it badly, and people can go into hospital again and again, query subarachnoid hemorrhage, query meningitis, and tests are recurrently normal. We talked about acute and preventative treatments. There are new treatments now for migraine which are very targeted. We call them GPANTs, calcitonin gene-related peptide receptor antagonists. They are very, very effective, and now they come in oral forms, so we've had a lot of success with those. Because remember that migraine is very common, but it doesn't mean that it doesn't have a huge impact on people's lives.